And tell us what you're doing, Beverly.
Okay, so we're now blowing up the balloon, adding some saline.
What?
Watching it as it fills. That's the casing that was holding that collapsed balloon has now opened it up. It's released it, and we can now blow up the balloon completely. We've added the methylene blue tinged saline to make sure that if there is ever a leak, we'll be able to identify it. Because they would pee green. We want to make sure that it's filled enough that it takes up space, but not so full that he's going to have any issues. This is a nice big stomach, so he's going to take a good amount of fluid. We're wanting to make sure that there's no leaks as we're filling it, which is why I'm taking a look below to make sure that it's nice and dry. Everyone's stomach is a different size, so we want to make sure that it's a good fit for each person, the amounts that we put in. So now I have 500 cc's in here. This looks like a good amount, but I actually think I want to put in just a little bit more. So go ahead and add another 50. I'm going to stop at 550. Yeah.
Have you add the fluid?
So you can see here, this is the tube that's connected to the balloon, that's connected to this syringe, and I'm able to count out exactly how much fluid I'm putting in. That's then connected to a one-way valve that's connected to this saline fluid. And basically you suck back on the syringe and the fluid comes out because it's a one-way valve. It sucks out of here, and when I inject, it only injects down into this balloon. So makes it more straightforward. You can see that the balloon, I'm able to get around it, I'm able to move around. Putting in a good position. Put in 600. Put in another 50. Yeah.
You want to record this?
So you can see there's a lot of space here, so I just want to give them a little bit more, just so it gives them a good amount of restriction. Good, and that's how we pulled it in. Now we're going to inject in the last bit. So now there's 600 cc's inside this balloon. It looks good, there's nothing leaking, everything looks wonderful. I can see that connector joint there. I'm done, that's good. So now I basically just have to gently pull on this. I disconnect the connector tube. And now I pull this out with that casing that you had seen popped open. I'm pulling it out all together. So now everything that's not supposed to be there is gone.